So good morning guys. Today the class about recovery from the anesthesia. So what is the recovery room? So recovery room is a hospital where the patient are placed after surgery. That is the operation that anesthesia. So they can monitor the recovery. He was monitored to recovery from the approximately 30 minutes after surgery. So what is the function? To accommodate of the group of patients who are undergone the surgery, need to close observation and promote the care event of sudden complications. So definition of the um, post-operative anesthesia care. So specialized care given to the patient who have undergone the anesthesia management by the team to will be trained to professionally and specially designed and equipment and designed to the area of the hospitals. So what is the purpose? Means successful and faster recovery to the patient post-operative and reduce the post-operative mortality rate, then reduce the length of hospital stay of the patient to provide the quality care of service and reduce the hospital patient cost during the post-operative period. So mainly here designated, located, stopped and equipped for main purpose of the hospital. So what is the size? Means so 120 square feet by every patient will be there. Minimum 7 feet between the beds will be there. So what is the facility? Means Fowler cot will be side rails and oxygen vacuum or multiple electrical outlets will be there. Large door will be there. Good lighting, isolation and everything will be there. So this is the recovery room. So one nurses, one patient with the first 50 minutes of recovery will be there. So every two patient, one nurse will be there. So anesthesiologist responsible for the remaining managing to the patient will be there. Adequate number of accelerating stops and techniques, ward boys, female attendants and all will be there. So parametric monitors, BP, pulse, ECG, intravenous supports, so that syringe pump and all will be there. So charting, bedside supply, storage suction, everything will be there. So immediately available for emergency equipment of crash cot and defibrillator will be there. So avoid the expose and avoid the rough handling, avoid the hurried movement to rapid change of the position. So routine of the post anesthetic care means criterion of the patient shift means shift of the operation theatre to post anesthetic care unit, then hemodynamic stability, clinical evaluation to complete recovery from the blockade, then maintenance of the oxygen saturation and what are the standards will be there. Mean receive the general anesthesia or regional anesthesia, monitor the patient should be post anesthesia management. Patient should be transferred to the by the member of anesthesia care team, then knowledge about the patient condition. Okay, mainly knowledge about the patient condition we can shift the anesthetic team. So the patient should be re-evaluated to the verbal report should be provide the nurse. The patient shall be evaluated to continuously PVC means we can wait. Then anesthetic to consult the response to discharge the patient. Okay, so mainly phase 1, phase 2 will be there. Phase 1 means immediate recovery phases to recover for intensive nursing care to detect the early signs of complication, then complete the patient record from the operating room, which is the plan for post-operative care. Then surgical patient immediately after surgery, the patient record to close monitoring. So phase 2 means care the surgical patient who has been transferred to the phase 2 first operative, that one. So post up to unit, then less observation and less nursing care mean that is phase 1. Okay, so step down progressive care unit, that one. So admission department, preoperative history we can, intraoperative procedure, type of anesthesia and blood label, everything, urine output and all we can assess. Then post operative pain management means intravenous opiates, Diclo IV, then paracetamol, anti-inflammatory drugs and all, midazolam for anxiety, then epidural, regional anesthesia, any blocks and all they're using like this. Then family and visitor information. So remember, rest are important for recovery room. Then resting from the pain medicine to normal. Allow the patient to rest after pain medication. So unable to visit means if you're trying to provide best possible care through the patients. The nursing management in the post unit means to provide care until the patient recovery from effective anesthesia, monitor the vitals and regulatory and depth and nature, assess the patient O2 saturation and skin color, keep the monitoring vitalins, then check the level of consciousness ability to respond to commands, maintain the intake and output chart, then product airway to proper position and clearing the airway, oxygen therapy. Then pharyngeal option can occur when the patient lies back, the changes the tongue follow due to that one. Maintain the IV stability means hypovolemic shock can be happen. So avoid the timely administration of the IV fluids. Then blood and blood product and medication. Replace the fluids, colloid crystals. Then monitor the intake and output balance. Assess the patient's surgical type, any hemorrhage and serious complication will be happen. Then immediately post-operative, several days to after surgery, untreated cardiac output, decrease the blood pressure to HP level and all. Then blood transfusion if necessary. The surgical taint incision should be inspected. Pressure the bleeding dressing site. Then consult the emergency explosion of the hemorrhage bleeding happen means keep the patient warm. Use the blanket or use the warm lights. Okay, warmer and all. Then relieve the pain and anxiety means administration of the OPR analgesic as per doctor. Epidural anesthesia and non-steroidal anti-inflammatory drugs, then psychological support to relieve fear and all, then post-operative nausea, vomiting, respiratory complication, failure consciousness, circulatory complication and fever. So controlling nausea and vomiting, it's a common problem of after anesthesia. So we can give metoclopramide and ondansetron. So it's MSET or anything we can give. Discharge of criteria from POC means the limit or discharge bar score can be used. So medical appropriate length stay PUC accurately. The patient must be evaluated after trainer staff to discharge from. Then criteria discharge to develop by the anesthesia department. Then depend the patient send the ward or ICU home. That one criteria. Then discharge the criteria from means easy arousability, then full orientation, ability to maintain product airway and stable the vital signs to at least 15 to 30 minutes, ability to call to for help. Then no OB surgical complication means active bleeding and all, it's not possible. So this is a normal criteria for the after discharge of the patient. So you can see if you're anyone asking this question, you can put vital signs, activity, nausea, vomiting, pain status and surgical bleeding site. So we can mention this like this only, then you can show the you write the exam. So teaching the patient self-care means expected to outcomes immediately post-operative changes, written instruction, wound care and activity, dietary recommendation, medication follow-up and all. So self-guidelines of discharge means the patient should able to stand means a few steps, then sit. Okay, should be able to sip fluids only, should be able to urinate, should be able to repeat post-operative management, should be able to identify the scan. This is a nurse's responsibilities. So we can check. Okay, so thank